Hey, thanks for joining us in studio with me is Caroline Benitez. She is with the Polk County Indigent Healthcare. She's a community outreach specialist. Welcome to the show.
Thank you for having me.
Well, talk to me a little bit about your background. What is it that you do?
Sure. So before joining the county, I had the privilege of working at a variety of nonprofits and philanthropic orgs across Polk County and the greater Tampa Bay area. I'm also a proud USF alumni from their College of Public Health. And you know, I'm really pleased to be using my experiences to do something which really matters to me, which is impacting the health of communities.
So how did you find the indigent healthcare gig?
You know, I guess it was just meant for me because access to healthcare has always been something that's really mattered to me, you know, so I feel glad to be working in this field. You know, I believe that health is more than just who you are, it's where you are. It's all about what resources are available to you where you live, work, and play. So in this role and at Indigent Healthcare, we really make it an effort to make sure everyone across Polk County has the resources they need to live life to their fullest potential for health.
Talk to me a little bit about what the Indigent Healthcare Plan is, the 30,000-foot view, for those that might not know what the program is.
Sure. So we strive to meet the needs of those who are medically underserved all across Polk County. Primarily, we focus on access to healthcare. We recognize a lot of people, either they're in between jobs or maybe they're working in a job that doesn't provide them an avenue to health coverage. So to help those folks, we have something called the Polk HealthCare Plan. And what that does, it provides an avenue for those who are uninsured to access high-quality medical care. So if you're eligible, you can enroll and you can access all the primary care you need, specialty care services, behavioral health even, prescriptions at a very low cost. And it's not an insurance, but it functions like an insurance. You would just pay a small co-payment per encounter, and it gets you that pathway to health care.
I want you to talk a little bit about how important the plan is, because when you do not have a doctor per se or a clinic per se, when you have the simplest of, you know, really bad cold, something, the tendency is to go to the emergency room. And that kind of clogs that up. But talk a little bit about what the plan does, from either getting people identified with the problems that they have and or continuing on and getting them down the path to where they have better health, they have better resources, and they have better care to not have these problems.
Absolutely. You know, there's a variety of reasons why a person might have an emergent healthcare condition. A lot of the times, people have a chronic health need that, you know, if they don't have a doctor, they don't have a medical team to help them, to help monitor those conditions and keep it under control, they might just ignore the issue, and it might get out of hand where they are to the point where they need to go to the ER. And, you know, some people have a family history of these conditions, and they might assume, well, if my dad had hypertension and had heart disease, or there's diabetes in my family, well, that's just how it's going to be for me. But that's not the case. If you have a family history, if you have a health need that needs supervision, that needs help, that we hope that we can be there to support you, get you access to a primary care provider who can help you set health goals, help keep those conditions manageable, maybe create some lifestyle changes to keep those conditions under control, get you access to the prescriptions you need to manage.
From your standpoint as an outreach specialist, you're really introducing the program to those that really don't know it exists. What is the reception like to those? I mean, you're out in the public, you're on the front lines of this. Do people know about it? Are people surprised? Talk to me a little bit about that.
Sure. I find that a lot of people haven't exactly heard about the plan, which is really a shame because there's a lot of folks in Polk County that can benefit. You know, compared to the national level of 7.8%, 11.5% of Polk County residents have no access to health coverage, or they don't have any form of health insurance. And that's what we're here for. We're here to educate people on what this plan can do for them. A lot of people just assume if they've never seen a doctor, or, you know, they don't have a way to access that primary care, it's just not going to happen. But that's not the case, and we hope we can be there and have those conversations, explain what your coverage options are, and to help you get enrolled if you are eligible.
Now, part of the gig, as we were talking before the show started, you know, calls for you to be out at nights, calls for you out to be, you know, working on weekends. Talk about some of the events that you work that you might get the word out.
Sure, absolutely. So again, we strive to meet the needs of everyone in Polk County, and Polk County is a very large place, as you well know. So we look for different avenues to meet with people, again, where they live, work, and play. So we bring our outreach team to a variety of locations, places like farmers markets, grocery stores, churches, different community events, festivals, things like that, where we can be there with our representatives. We can talk to people about the plan and talk to them about other community resources. Just as well, we have a partnership with the Department of Health, so we're able to bring out a health nurse that can provide free screenings for things like cholesterol, blood glucose. They can provide vaccinations as well on the spot. So it's really a one-stop shop. You can meet with a nurse, get those health screenings, start that conversation. And if you don't have a way to access long-term care, then we'll be there to talk to you about the plan and what your other options are for seeking care.
Now, if you're a group or say, a community or whatever it may be, and say you have folks that live within your area and would like to invite you guys out, are you guys available for that? And how do they go about doing that?
Absolutely. They're welcome to give our office a call and get connected to me. I'm happy to say yes whenever possible. We love to be out and meet with people directly. We'll have speaking engagements to talk about the plan. We can also be there again, as we said, with health screenings, with a nurse, have that entire conversation about health. We also have a variety of health partners, different community organizations that have their own services. So again, it's a team effort. We like to put on health fairs in different locations across the county. So we can have that access to a variety of different resources. Folks can see what sort of services and support is available to them. So really anything goes for outreach. We're happy to work with the community, and we're open to any ideas.
Aside from the buses at Citrus Connections, the two most popular vehicles that I see out in the county, because they're just brilliantly wrapped, is our PGTV truck and the Indigent healthcare truck. Talk to me a little bit about how that vehicle allows you to take the show on the road and get out and even further meet the folks and introduce them to the program and get them screened.
Absolutely. As you said, we have a mobile unit. It's a big bus about the size of an RV, and that can be a one-stop shop for health screenings and information on the Polk HealthCare Plan. So that really allows us to be in the community. We like to park in places like grocery stores, maybe at a church event, at a food pantry. It's a big advertisement for what we do. It draws people in. And then, once they're attracted to that bus, we can get them on. We can have that interface with a nurse. We can talk to them about the Polk HealthCare Plan. It's really a one-stop shop for everything they need.
We've got about a minute left. I'm going to give you the final word on this. So if you would, inspire folks to get involved, to contact you, and how can people find out more information?
Absolutely. At the end of the day, I think if you've had difficulty accessing care, navigating the healthcare system can be a little bit overwhelming. So we hope we're the first people you call when you need help for getting that care. We want to be here as a resource for you, and we want to be out in the community. So if you have any area associations, for example, different community groups, different events, we want to be there. We want to meet with people in neighborhoods and talk to them about the plan and talk to them about what other resources are available to them. So we're here to serve, and we're here to be out, and we hope to meet with everyone.
Always a pleasure seeing you, and anytime that you have anything going on, please come back and see us, and the chair is yours.
Sounds great. Thank you.
The Polk County Indigent Healthcare Plan strives to meet the health needs of Polk County residents through community outreach events. Now, these events are a way for residents to learn about and sign up for the Polk HealthCare Plan. Through a partnership with the Florida Department of Health, a variety of free health screening services and vaccinations are offered. Up-to-date information on upcoming events can be found on the Polk County Indigent Healthcare website at polk-county.net. If you enjoyed that episode of Polk Place, I invite you to like, share, and subscribe to the channel, and even check out the next one.